And thank you, Karen, for starting the recording. My name is Lily Sobolik, and I'm a senior policy advisor here at DFR, and I will be facilitating our drug price transparency RAC meeting today. Go ahead and go to the next slide. Perfect. So we'll start off with introductions of everybody who is on the RAC. Then I will go over our process and a little bit of background for why we are all here. We will together review and discuss the draft rules. We'll have time for public comment, and then we'll talk about next steps. And I do want to encourage any RAC members to feel free to interrupt me with questions at any time just by raising the hand. So first, let's go ahead and do RAC member introductions, and we'll just start in the order that folks are on the screen in alphabetical order. So Charlie, would you go ahead and just do a brief introduction of who you are and who you represent here today?
Sure. Charlie Fisher, State Director at OSPIRG. We're a statewide public interest group. I'm very interested in the cost of prescription drugs and transparency. Also here on behalf of OCAP, the Oregon Coalition for Affordable Prescriptions, which is a coalition of organizations that care about the same things. So I'm happy to be here.
Thanks so much, Charlie. Glad you're here. Daria, would you go next?
Morning, testing. Good morning, Daria McGrew on behalf of Pharma Research and Manufacturers of America.
Thanks, Daria. Glad you're here. Gregory, go ahead.
Good afternoon. I'm Gregory Halen. I'm the senior manager with Par Health. I'm here representing them.
Wonderful. Thanks for being here. Excuse me. It's allergy season here for me, so excuse me if I'm a little sniffly. Lynetta, please go ahead.
Hi, good afternoon. I'm Lynetta Moore. I'm the Senior Director with IntegraChain, and we are all things state transparency reporting, so happy to be here.
Wonderful. Really glad you're here.
Thank you.
Next, we'll go to Madonna.
Hi, I'm Madonna McGuire-Smith, and I'm the Executive Director of Pacific Northwest Bleeding Disorders, representing all people with bleeding disorders in Oregon and Southwest Washington.
Wonderful. Thanks so much. Melody, let's go to you next.
Hi, everyone. I'm Melody Calkins, representing both BIO, or the Biotechnology Innovation Organization, as well as Oregon Life Sciences. BIO is a representative of biotech companies, industry leaders, and state biotech associations in the United States and more than 35 countries around the globe.
Great. Thanks so much, Melody. And Mike, we'll go to you next.
Hi, good afternoon. I'm Mike Leone. I'm the Chief Operating Officer of Resilia Pharmaceuticals. We're a small dermatology company based in Atlanta, but with sales across the country.
Wonderful. So glad you could be here. Thank you. And Samantha, we'll go to you next.
Good afternoon. My name is Samantha Kirkland, and I am a Senior Analyst with Two Labs Pharma Services.
Well, thanks for coming. And Tim, we'll end with you.
Sounds good. Hi, I'm Tim Litton. I am a consultant working for Bausch Health in the state price transparency.
Wonderful. Well, it looks like we actually have everybody here, which is fabulous. We also on the line, I know we have a few DFR staff from the DPT program as well, and our rulemaking coordinator, who we couldn't do this without, Karen. So we're a small and mighty crew today, and we'll go ahead and get going. Go ahead and go to the next slide, Karen. Thank you. So just a little housekeeping. Please try to remember to stay muted. You can use the raise hand function to speak. Feel free to pop things into the chat. And we will have time reserved for public comment at the end. And I'll say this probably multiple times, but I know we'll be having a discussion and hearing perspective from all of you today. We really do request that you provide that comment in written form as well, just so we can make sure we're really clear on your perspective and feedback. And we'll provide a timeline for that feedback as well. Okay, we can go to the next slide. And I know many of you have been involved in rulemakings for DFR before, and some of you have not. So I'm providing a little bit of an overview of our process and really what this means. So rule is defined in Oregon statute, as you can see with the reference above, and it's really any agency directive or regulation that implements, interprets, or prescribes law or policy. And rule has the weight of law, and it must be consistent with statute. And so that's really what we're here to do today for the Drug Price Transparency Program. You can go on to the next slide. So the role of you all today, the advisory committee, is representing interests of those who are likely to be affected by the rules that we're promulgating and drafting, and to provide advice, recommendations, input, feedback. And there is a really formalized process that Karen, our rule coordinator, facilitates and manages, and that's with public notice, and all these things happen after the RAC process, after we've gotten your kind of more informal input. There is a process for formal input with a notice of rulemaking, a public comment period, as well as a public hearing. And you will all get all of those notifications as well. Karen, is there anything you want to add to that process?
Nope, you covered
Okay.
it very well. Yeah.
Okay.
Thanks.
And we're certainly here to answer any questions any of you have about that process, kind of offline too. Yeah. Okay. So I wanted to give, and I know you've been able to look at the slides and look at the rules. So this might be, kind of doubly redundant, but just wanted to give a high level overview of why we're here today. We're really hoping to do two things with these rules. We're hoping to make some general updates. There were some temporary rule changes made in February of 2026, and we're hoping to make those permanent, as well as do some, kind of internal citation corrections due to that. And then we're also planning on updating the annual price increase section. So what this would do is align with the 2024 rulemaking, which some of you were here with me for that. And we're also hoping to simplify the reporting by formalizing some data that's already required for manufacturers to have, formalize that collection, and adding some clarifying language. So that's really how DFR is thinking about this rulemaking, is we're hoping to do those two things generally. You can go to the next slide and we'll dive in a little bit more. So I want to start with our temporary rules that we are making permanent with this rulemaking. So as many of you know, there has been an ongoing lawsuit with DFR regarding this program. And this has been between pharma and the state of Oregon. And I'll just provide a really kind of brief overview of the status of that case. So in February, pharma filed a cert petition with the Supreme Court. The court then asked the state of Oregon to provide a response to that cert petition. And DOJ, the Oregon Department of Justice, just filed that, I believe, May 29th. And Oregon does not expect an answer from the court on whether or not it grants review until the end of the term, so late June or early July. So I guess we are already in June, so that is actually coming right up. Hard to believe what month we're in right now. So that's just a little bit of an overview of where we are in that court case process. And so what we were doing in February, we did temporary rulemaking to align rules with the Ninth Circuit opinion in Pharma versus Stolfi. And so that was done on a temporary basis because we were in the legislative session. And so folks were very busy here. And just with the reporting timing, we wanted to make sure those rules were in place. So what this does is it's reverting voluntary data collection language back to the original mandatory reporting language and time frame. So we would resume mandatory collection of required price increase reports due March 15th annually. And, what I think I want to do is, if it's okay with folks, or mostly if it's okay with Karen, I would love to just show, switch from the slides to the rules itself so I can point out those two places. Thank you, Karen. So there are really two places where this would be happening, and have marked it in comments. So this is in 0515, and you can see all of these, almost all of these changes, changing it from February to March, from 2024 to 2020, and changing it from may voluntarily back to must. Those are the substantive changes that reflect making permanent the temporary rule changes. Sorry, this is all kind of a mouthful. And then I believe there is one other place. Yeah, I marked it with a comment as well. Yes, it's that SL3 comment. So again, you can see that where I've highlighted exactly. Thank you, Karen. So that would be removing the may be voluntarily and changing it to must include that information. So those are the two changes that really represent making the temporary rulemaking that is in place now, making that permanent. Daria, please. Yes.
Thank you. Thank you for convening this. Just our legal team on behalf of Pharma would like me to state for the record that we continue to believe Oregon's Prescription Drug Price Transparency Act and its implementing regs are unconstitutional, and in participating in this RAC and commenting on the draft rules, we do not waive our legal arguments. Thank you very much.
Yes, yes. Appreciate that comment. Are there any other people on the RAC who would like to comment on this portion of the rule, which is making the current temporary rules permanent, which means reverting back to the rules as they were? Sorry, I can't remember actually, pre-2024. Yeah, Lynetta.
Hey, just a quick question. In 0515, it says the date is back to 2020.
Yes.
During the time frame where there was the suspension, is the state asking for anything to be made up, or is this
No.
just going forward?
That is a
going
great
forward?
clarification. Yes, just going forward. Yep.
Okay, thank you.
Yep. Yeah, let's see. Mike, go ahead.
Hey, good afternoon again. One of the questions that I had revolves around when reporting has to take place. As an example, we didn't purchase our drugs until technically December of 2020. So, and two other companies had them before we did. So asking for things to be retroactive before that would be somewhat onerous and difficult to go back and find. But if all you're saying is effective that date, we have to report moving forward, we can live with that. The question has, as I read some of these to start with, was like, oh my gosh, where am I going to find that from two other manufacturers who one of whom isn't in business anymore? How do I find that information? So as long as there's no penalty for not knowing that information before, like 2020 or whatever, then I think we're okay with it, with the wording. But I want to make sure that there's an understanding that sometimes that information may not be readily available. And I know you got a question in here at some point about clarifying what the reporting periods are, and I think that's essential. A little parenthetical just for reference. I'm also a soccer referee and was head of new referee training in Georgia. All the soccer rules change on July 1. So if you say the soccer year, everybody in soccer knows that's July 1, but you wouldn't know that any more than I would know what your fiscal year requirements would be without that background. So I highly suggest that when you talk about quote reporting year unquote, that you list what those dates are, just to make sure that everybody does what's needed to be done at the time frame that's needed. So that may be redundant. I'm sorry if it is. So.
Oh, we appreciate redundancy here, in an effort to be clear. So to take your points, kind of piece by piece, and we'll get more into the reporting year, but I appreciate you bringing it up. There's no, like I kind of responded to Lynetta, there's no expectation that for that gap when these rules were when this reporting was voluntary, there's no expectation that there would be any back reporting needed for those years. And Mike, in terms of your specific question, this reporting requirement started, and program staff, correct me if I'm wrong. Well, actually, I'm just looking at this rule. Yeah, there would not be an expectation to backdate anything. This is all about going forward. And this reporting started, it looks like at the very beginning in 2019. And certainly we don't, and again, program staff, feel free to correct me if I'm wrong. We don't expect, this is done by the manufacturer. So if you do not own a certain drug, you're not required to report for when you did not own them. Is that clear, program staff? Anything you want to clarify based on what I said?
For
No,
my
that's all
benefit.
correct. That's all correct.
Great, and thank you.
Okay. All right. Thanks, Sophie.
That would be wonderful to have that in there someplace, because I'm sure I'm not the only company who's bought a drug since then. And I mean, which is not to evade the rules, it's just to make sure that we do them properly.
Of course. Yep. And that's something that I can talk with program staff about, because I know they do have manuals, kind of reporting manuals, to see if something is already there, or if that's something that we should prescribe in rule. Gregory, go ahead.
Yes, I'm just, excuse me, looking at the page on the screen, and I'm reading section 2A, and
Yes.
I noticed that there's a difference between the line that's written there and then the information that's posted on the manufacturer's page under annual price increase reporting on the drug price transparency website. There is a caveat for drugs that are not supplied over 1 month. It says, or for a course of treatment lasting less than 1 month. So I just want to make sure that we have consistency and understanding there, that if the trigger for the reporting is for a product that isn't dispensed over a 30-day or 1 month period, that it applies to the course of treatment that lasts less than that period.
Gregory, I love the close read and the comparison, and I will double check this, but so the rules that we sent to you with the edits, these blue line edits, those are not the comprehensive DPT rules. I only shared the rules that we are editing, and I believe, though I'm not going to be able to look it up while I'm doing this, but I believe the definition for 1 month supply, which is in, I think, 0500 or 0505 or something. I believe that definition of 1 month supply includes exactly what you're saying and what is on the DPT
that
website.
Sounds familiar from our previous discussions,
yeah.
but just wanted to make sure.
Yes, no, and I mean, that's exactly the kind of close read that we're hoping folks will do. Oh, and thank you, Sophie. Sophie is the fabulous DPT coordinator who's putting in that definition right now. Okay. Are there other kind of thoughts or questions about just this temporary rules becoming permanent? Okay. Oh, Charlie, yes, great.
Yeah, I mean, nothing of too much substance other than to say we're really happy to see this, and very supportive of making these permanent once more.
Thank you, Charlie. Appreciate that comment. Okay, Karen, if you could go back to the slides, that would be great. Go to the next one. Okay, so now to the more the newer and in some ways more substantive, at least with volume, changes, the annual price increase updates. And so we'll do just like we did before. I'll kind of go over how DFR is viewing these as an overview, and then we will go to the rules themselves and we can talk as nuanced as we want, line by line. So we're really thinking about these changes in 3 different ways. Aligning with the new prescription drug changes from 2024. So that's creating a separate section so it's easier to reference and it's not so buried. And also adopting some similar language about factors contributing to price increases. We are also proposing that we collect new data from manufacturers. And this would be information that manufacturers already use to currently report data. What it would do, we do recognize it would be asking for some new data fields, but that would allow for better staff verification and provide more transparency to the public. We're also hoping to clarify some concepts, Mike, like you already brought up, reporting year, healthcare professionals, and then adding in, we already have net profit in the rules themselves, adding in or loss. Just some manufacturers already report it that way. So again, just trying to clarify what's already happening in practice. So that's the high level overview. And I think, let me just check. Oh, you can go to the next slide too, Karen. That's, a little bit more housekeeping. The other thing that we're doing, of course, is doing citation updates based on these changes. So you can see the main one is because we're creating a new section correcting all of those citations. And then I have just listed the rules that we are proposing to update, and a number of those are just solely citation updates. And with that, actually, before we go to the rules, let's go to the next slide and go through specific questions. And Mike, again, you already brought up this, potential definition of reporting year or perhaps different terminology for that concept. I have some specific questions around whether or not the use of the word changes is clear. And then, of course, if you notice anything, any citations that we have missed or any other kind of clarifications or alignments, those are specific questions we have. Of course, as we go through the rules themselves, happy for other feedback that doesn't touch on any of these. So with that, go ahead and go to the rules themselves, please, Karen. And you can scroll down to the next one. Great. Yeah, you can just scroll down a little bit. So this is really where the bulk of the changes are. And one thing I do want to warn people of, yeah, great, is when this is officially done for the notice, it will look a little bit different. The reason I did it, like all the content will be exactly the same, but I will need to, formally delete the portion in the prior rule. So it won't look exactly the same. I did this for clarity for our discussion purposes. So again, no content difference, but it just might look a little different. So I'll just open it up and we'll start on this new section, the 0533, separating out the annual price increase. Yeah, Melody, please.
So first, I'd like to echo what was mentioned before on reporting year. We believe that this is currently written is too ambiguous. I think the previous version of this rule was more clear with that because it mentioned prices in the calendar year, saying that I think if it was like a March 15, 2027 report, then they would look at January 1st, 2026 to December 31st, 2026. And so whether it be reverting back to that or some other clarification, but we do feel like that is very much needed to be able to understand what the state is looking for with that.
Okay, that's really helpful. So looking, I mean, we have one example right here in front of us under 2, the new 2. So the price of the drug at the beginning and end of, you would like it to revert back to, of the calendar year preceding the report. That would be preferable.
That might be the easiest way to do so. I'm definitely open to other ideas, but yeah.
Yeah. Lynetta, go ahead.
And I'm being picky, so I apologize. But
We want that.
so prescription drug reporting, and then it says for drugs. So everywhere it says drugs, the assumption here is that it's prescription drug because prescription drug is a
Yes.
defined term. So for me, I would like to see it read as such for prescription drug, meeting the specifics and so on and so forth. Because if you scroll down a little bit, you'll see that it does reference prescription drug in a certain area here and there. And I do very much concur that the reporting year, if it's a defined term, if you provide a definition of a reporting year, then you can refer to it as that, as that reporting year. But I do think it's very important to understand what that reporting year is because there are, calculations and things tied to this as well. So for consistency purposes, I'd like to make sure that we are talking about the defined term prescription drug in this section.
That's really helpful. And I mean, you said 2 comments, and I want to address both of them. The adding prescription in front of every instance of the word drug. These rules were originally written not by me back in, I believe, 2018. I have listened to the recordings. There are some videos. And I think that's something that when you're writing new rules from scratch for a brand new program can be really challenging to have that level of consistency. So that's certainly something I am happy to consider. My concern, just thinking about that off the bat, Lynetta, is that if we did that, we would want to open the entire rules and make all of the corrections, which maybe we want to do. It's just something I would want to give a little bit more thought to.
Thank you for
Go
that,
ahead.
though. I appreciate you taking the suggestion.
Yes, yeah, certainly. And then your other comment was about again, having a more clear definition of reporting year, right? Either
Make it a
in the
defined term.
definitions, yeah, having it be a defined term. Or, I mean, Lynetta, I'm curious, I mean, because you've been doing this reporting for maybe since the program has been.
Yes, ma'am.
Yes, okay.
Since the beginning.
Since the beginning, great. That's so helpful to us. So, Melody's idea of perhaps just reverting back to how it was there any confusion around that terminology, just using calendar year preceding the report?
I'm just looking for consistency because if you do that, then you kind of have to follow that through the other things that you're writing here. But if you define it, then you can always, from our perspective, we like those definitions because then you tell me very specifically it's the reporting year, and then I can revert back and look at a definition of what a reporting year is. Because sometimes, when we're talking with manufacturers and things, they get very confused, and rightfully so, because I think one of the gentlemen here was saying, I'm using an example because some manufacturers use a physical year, some manufacturers use a calendar years, and a lot of times there's confusion. But if you define that reporting year and then you're consistent through everything you do with a definition, that seems to be a little bit easier, a little more palatable for the manufacturers that we work with.
Yeah, that's really helpful, Lynetta. Thank you.
Thank you. Thank you.
Yeah, Mike, go ahead. You're on mute still if you're talking, Mike.
Sorry. Most people tell me to go on mute as opposed to get off. my suggestion would be to dovetail what she just said. Just create a set of definitions. The word drug means prescription drugs. The word year means the calendar year from January 1 to December 31. If you create a set of definitions in like a table format where everything references those definitions, then you may not have to go back and put the word prescription in front of every time you say the word drug. And for that purpose, you'll have a set of definitions, out front. Everybody can look at them as they read the document and go, okay, what did she mean by year? Well, according to this, year means calendar year, those kinds of things. And so it might be very simple, just like she suggested with the word prescription and either a glossary or a reference table, whatever you want, to put those kinds of things in one spot so that they're all out there once and for all. Everybody sees them and they're all playing off the same sheet of music.
Yep. And that's exactly what we do have, not for these terms, but that's what's in 0505 that Sophie put in the chat. And where we would put, if we, I'm not saying we're doing this yet, but let's say we do make the change to reporting year based on this conversation alone, we would put a definition of reporting year in that section. And I don't think, again, this is from memory and I'm not going to look it up while we're talking. I don't think we have a definition of prescription drug, but actually maybe we do. Sorry, I can't remember. But yes, that's exactly the type of section that we do have and where we would make these changes, Mike. And we try to do them with as little disruption, unnecessary disruption to the rest of the rules. So yes, appreciate you thinking like that.
Thank you.
Yeah. I'm gonna, kind of open it up again to just your kind of general, I know we've been really focused on, kind of smaller or more nuanced pieces like definitions. Are there any other kind of bigger picture feedback that you would like to give on some of these changes? Yeah, Daria.
Thanks. On the now, let's see, changing to, no, 9, the new 9,
Okay.
where you're expanding on the factors that may,
Yep.
and recognizing that is copied from the other section, but
Yes.
Generally speaking, we do have concerns with asking manufacturers to report information about other manufacturers' drugs. We don't think that manufacturers should be reporting on prices or other competitive products of other manufacturers.
Thanks, Daria. And Karen, if you could just scroll down a little bit. I know I should have hidden those margins. Thank you. That's perfect. Yeah, Lynetta, go ahead.
Yeah, I have to echo that as well. That's something that is really unpalatable to the manufacturers because, they're reporting on prices that they really have no input or no, there's nothing that one manufacturer can say about another manufacturer's drug without there being some concerns. So it's really something that is very difficult for the manufacturers to even try to do. So it just becomes very, very, very difficult, to look at and see because brands may not necessarily look at anybody else's products at all. Generics, they may or may not. They may not look at these things, but that is not something that most of the time manufacturers are going to be able to do.
Appreciate that. Yeah, Melody, go ahead.
Yeah, we would agree with what's been mentioned already about the concerns in the section 9, but also with the language having all factors there as opposed to the previous language of just the factors that contributed to price increase. I think that expansion really does create more operational burden for manufacturers and is pretty subjective language because there's no clear standard on the level of detail required here, which would also result in inconsistent enforcement. So we do have concern with the expansion of the current process which currently allows for more flexibility for manufacturers to describe those factors as opposed to requiring all of the factors, whatever that should mean.
Appreciate that. Oh, go ahead, Madonna.
Yeah, I know I represent patients, but I just have a question. Where did that wording come from? Was it something suggested by staff or was it legislation? Like, where did the wording of other manufacturers, other prescription drugs come in?
And you're talking about this part, like A through G
Yeah,
in
like
9 that's up on the screen
yeah.
now. Yes,
Yeah.
you're asking me to go back in history where I was there, and it was only, two-ish years ago. But these are, like I mentioned, like Daria referenced. So we had a rulemaking back in 2024. I think they weren't published until 2025, or finalized. But these factors were added at that time to a different part of the reporting requirements. And I am not going to be able to come up with how we drafted these. I think these are, broadly based on the types of information that manufacturers already report, as examples of factors that impact pricing. And so this is an effort for us to capture again, and we've heard this a few times in like kind of a consistent reporting way, because one of the challenges of these things, and folks have referenced this already, is we want to have really consistent data both for manufacturers, administrative ease, but then also on the other side, when we are showing this information to when we have this information available to the public, we want it to be easily compared and understood. So this is our effort of, these are what manufacturers are reporting. These are kind of the distinct categories. And Sophie, correct me if I am wrong on this, but I believe these, because I'm not in the actual reporting kind of software system, but I believe for any of these, a manufacturer could put that something is not applicable. Is that right, Sophie?
Yes, we only want them to list factors that are included, not, they would not be listing all of these. They would just be listing the ones that apply to their situation. These are merely examples that we have seen. And these are all things that manufacturers have cited.
Okay.
Yeah, and
that clarifies for me. I just wanted to make sure that we weren't asking for something that was impossible for people to put into reports, because it sort of feels like if you manufactured pencils, like, do you really go out there and check what all the prices of all the other pencils are? Like, no, you just put out your price of your pencils. So I just wanted to make sure that we weren't like forcing something that couldn't be done.
You'd be surprised the number of pricing that is purely done on competition, but yes, I'm sure there are plenty that are not.
That's right. I mean, I don't know that's out of the world, so I get it. So thank you for clarifying.
Yeah, the other thing that I'll just note, like Melody, I really do hear, you had a specific comment on the shift that's on the prior page, but don't go to it, Karen, about all factors. I'll point to this language right here it's new in blue. Factors may include, but are not limited to. So that's really kind of permissive language. It's like your factors might include these things. They might not. And there might be other factors that aren't listed here, and you'll have the opportunity to, write those or submit those as well. So these are, like Sophie said, meant to be suggestions, and they are things that have been submitted before. And there would certainly be the opportunity to, in the other category, to add things. But Charlie, I know you've had your hand up for a little bit. Go ahead.
Yeah, thank you. So I was going to point out what you just said, Lily, that it does say may include. So to the extent that some of these factors are not ones that led to price increases, then the way I read it doesn't require them to be listed. And I think it is, yeah, in the case that oftentimes prices for lots of products are based on the prices of their competitors. So that seems like a reasonable thing to include. There are two suggestions that I had to, I think, make this information a little bit more useful. The first is requiring manufacturers to provide some kind of weight for each factor they include. Like, this factor was 80% of the price increase and this other factor is 10. Because looking at the reports from previous years, at least what I've like in the DPT report, it looks like manufacturers just kind of list all of them and say, this is what we thought about, which isn't very helpful when we're thinking about like what are the actual drivers of price increases. So maybe something like, the percent impact on the price increase or the weight that they placed on it, something like that. And then the second suggestion I had was, I know we've also had a lot of issues with manufacturers claiming very broad trade secret protections for information that may or may not actually be a trade secret. And so I wanted to suggest adding something that was recently included in the Healthcare Market Oversight Program rules that OHA was doing. I know there's already something that says that manufacturers have to provide justification for why a piece of information is a trade secret, but there was something added in the HICMA rules that said if they don't adequately justify grounds for confidentiality, then that's and if they don't respond in a timely manner to correspondence, that may result in the denial of those trade secret claims being accepted. So I think just for the purposes of making sure that the information that's being reported is actually useful, those are two suggestions I would make, and we'll follow up with a written comment with more details.
Thank you, Charlie. Appreciate both of those and the written comments. Daria, go ahead.
Thank you. Thanks for pointing out that this is permissive. We would have large concerns with any suggestion that it should be quantified. Quantifying the relative weights of these factors in the decision making would be very hard for manufacturers to comply with.
Thank you. Samantha, we'll go to you next, and then Lynetta.
Thank you. I know that this is a little bit, please let me know if I should email you about this separately. But you said that for the price increase factors, as far as like competitors and comparing it, that's only if it's applicable. With the new drug reporting, the pricing methodology, I know that requires for you to explain the pricing methodology comparatively speaking to like a generic to a brand name drug, and you have to list the percentage and the drug you're comparing it to. So is that optional as well, like only if it's applicable for the methodology part, or do you still have to list?
I'm sorry, I'm not sure that I'm following, probably because I am not in the, in the weeds of actual submissions. You're welcome to try to explain it again to me, and Sophie, you're welcome to weigh in, or you can email me and we could have this as part of, if we do have a follow-up meeting. Happy to have that conversation.
Okay, yeah, I can send it in an
discussion.
email just so that it's to bring it down a little bit more. Just because I know that that's part of the new drug rules, and I don't want to mix that up with what we're doing today. But I just want to make sure that we're clear on, as far as listing competitor and competing drugs, what the rule is going across for that.
Thank you. Yeah, Lynetta, go ahead.
So I would echo what Daria is saying here. Giving a weight to these factors is not something that manufacturers readily do. They don't look at from that perspective. I mean, they look across and say, what do I have to do? And a lot of them are really trying to hold their prices lower than not take price increases as much as they have maybe possibly in the past. And then from the perspective of a trade secret, particularly if you are a privately held company. Now, maybe on a 10K, there might be some information on some of these manufacturing, marketing, or distribution costs. But particularly for a private entity, all of this is definitely a trade secret. So I feel like justification for that is looked at it at two different types of companies here. If it is a publicly traded company, there may be more information that's out there, but these costs particularly are something that are very heavily guarded by the manufacturers, and it is their proprietary information. And particularly if it is a privately held company, I think these justifications are quite warranted for those types of things, because it is a competitive landscape out there. And the manufacturers, well, none of us want to pay more for their drug prices. I don't. I'm a consumer. I don't want to pay any more for my drug prices, but I also understand that the manufacturers do have to. There has to be a balance there. So allowing some of these things to be trade secrets, I feel, is very justifiable for the manufacturers.
Thanks, Lynetta.
Thank
Appreciate that.
you.
Yeah. I want to open it up again to other portions of this rule that we have proposed changes to. Yeah, Melody, go ahead.
So later on page 4, when it's talking about patient assistance programs, so our members looked at the patient assistance program reporting requirements across all their states and actually found that it seems like this proposed language is even more expansive and burdensome than any other state. Typically, states only ask for high-level PAP information. But here you're seeing that you guys are requesting the specific data on consumer accounts, assistance value, refill limits, and all of that, which really we had concerns about this significant burden, and also just the disclosure risk on programs that are ultimately designed to reduce patient out-of-pocket costs. This specific detail might not also be readily available in existing systems. There's back-end manual reconciliation that might need to be taking place across different vendors and hub data and copay programs and finance reporting teams. And so all of this is actually pretty burdensome. And of course, there's even the unintended consequences of that burden. And we definitely don't want to make it harder for manufacturers to make available these important programs. And so wanted to raise that as a concern that we've heard from members, and hope that the state will consider looking at how other states are doing their PAP reporting and have that be less burdensome.
Appreciate that comment. And one thing I will just note, in case it's not clear for everybody, is that we're actually, in this rulemaking, we are not proposing any substantive changes to the patient assistance program reporting. This, how it's written, except for the underlined in blue or strikeout citation changes. Yeah, thank you for highlighting those. It is as it has been, I believe. I'm just scrolling down myself to look at the reference. Oh, I guess it has been that way, that reporting for, it only says 2025, but I guess we maybe made a few edits in 2025. But that's substantially, I don't believe we made huge changes to that in 2025. So it has mostly been as it was originally. Oh, thank you, Sophie. Only renumbered in 2025. So it's been this way since these rules were promulgated in 2019, 2018. So we're not proposing any changes to that right now.
Thank you.
Yeah. Other kind of overarching, if you could go, yeah, Daria, go ahead.
Thanks. Question about an edit that you're not making. In 2024, you updated in 0520, you updated the threshold for specialty drugs to align with the CMS update. And my recollection at the time is that you don't believe that Oregon Constitution allows for like an automatic link to CMS. So wondering if you've considered, since you're doing this now, updating to the 2027, which is now, I think, 1080.
That's a good point. You know, that's not something I had considered, but that's a very good point, and I'll take it back to the team. Thanks, Daria. This could be due to me not realizing it is pretty much summer now. So time, you know, it's like, oh, it feels like we did that rulemaking and we're in this place so recently, but actually it was, you know, 2 years ago. Appreciate it.
I could have sworn we just did that, but no.
Exactly. Kind of overarching comments on if you could go to 0533, the new section, Karen. Yeah. Because I do, you know, as we stated, I do recognize we are asking for some additional information, not just those kind of pricing factors, but the actual the price and date for each price change during the reporting year or whatever we end up calling it. Just wonder if there's, you know, our thought is that that would not be very burdensome to manufacturers because that is information that you already have available and need to do the reporting that's already required. But would love to hear, you know, perspective on that or other kind of overarching comments. Yeah, Mike, go ahead.
And I actually clicked the mic button so I can talk. I don't think this part of it is difficult.
Okay.
Because to your point, I'll make up a number. If I'm charging $100 for a drug in 2026 and I raise it to $103 in 2027, I already know what I'm charging this year.
Right.
To go back to the previous discussion, and this is going to sound rude, I just don't know how else to say it. I don't think it's Oregon's business to know what I pay for drugs if I'm a private company and what my manufacturing costs and my distribution costs are, because as soon as I make those private things public to you, they become public record. And now I've divulged a lot of things about my products that I didn't want anybody else to know, especially if it's in a competitive market. But I don't think this part, just telling you what the old price was versus the new price, I don't think that's really difficult and onerous at all. So that part of it is fine.
Great. I really appreciate you weighing in on that, Mike. And I will say, you know, this is not an area that I am as intimately familiar with, but in terms of you know, kind of the public record aspect. I know we've brought up trade secret a little bit. Manufacturers do have the opportunity to claim certain data fields as trade secret, where they would, you know, I'm not an attorney, but where I think the burden for making those available in a public record request would be much, much higher and much more unlikely that they would be shared. And I see that Sophie put something in the chat likely about that. Yeah. Yeah, Lynetta, go ahead.
So just me thinking out loud, because this is what I do. So you have manufacturers out there that will launch a product, you know, so the price at the beginning of the year, it may actually sustain a price decrease. And then maybe later in the year, the price will change again. So I'm just trying to make sure, because I'm trying to understand also some calculations and things of that nature. But we lovingly refer to it as yo-yo pricing, because you may actually have a higher price at the beginning of the year. You may take a price decrease, and then you may have competition that comes in or exits the market and then adjust the price again at the end of the year. How does the state take into account that yo-yo pricing?
Take into account in what way? One thing I will, yeah, go ahead.
I mean, there's times that, as we're looking at the calculations, particularly to talk about, what constitutes a price increase and what, kind of this annual price increase. And so overarchingly, so we do see manufacturers. I mean, I think we see everything because we kind of have so many that we're supporting, but we do see a lot of competition where the price may be $50, and I'm making up silly numbers here. And then mid-year, more competition comes in, the price drops substantially, something happens with competition and they're out of the market. You're asking for the beginning and the end, but if there is anything that happened to kind of predicate, what are you using the beginning and the end pricings for? Is it part of the calculations that you're looking at, or what's the purpose of having the beginning and the end of pricing?
Yeah, I mean, it's a good question. And in this new proposed rule, we are asking for all of that, right? Kind of like you're saying, we're asking for if there's any yo-yoing, we're asking for all of it now. And in my mind, and program staff, please feel free to jump in. A lot of the beginning and the end, I do think is, calculating and verifying that this meets the criteria for submitting an annual price increase. I think the kind of yo-yo part is also giving, like you're saying, giving that some of that context to consumers, like just through our general transparency and reporting, is kind of showing that story and what might be going on. But I do see that.
Yeah,
Sophie's-
and Sophia, you're right. Manufacturers do take price increases on the 1st of January. Used to be very common that they take price increases on the 1st of July. There's been some dynamics in the marketplace, that after 25 years, there's never everything is still the same, but it's a lot. But we're seeing manufacturers move away from January 1, some still stay with January 1. We're just seeing a lot of different dynamics in the marketplace that may have been there in the past and maybe not. So I was just kind of trying to understand from the state's perspective, what are you doing with this data?
Yeah.
Yeah.
No, I think it's a really good question. I think part of it is trying to understand that story ourselves, and also sharing that story, right? And it's like, oh, that's very interesting to me that, you're seeing those changes from, January 1 to July 1 or whatever it is, and to be making those transparent to the public as well. Sophie, go ahead.
Okay.
Yeah, and just to add to what Lily said, that's exactly correct. So the public can see what's happening with these prices. But also another thing that 2, 3, 4, and 5, I'll go into whether 6 is calculated correctly or not. And so that's one of the things too, because it is kind of a complicated formula with the daily weighted average between the 2 calendar years to determine if a report was even required or not. And so some of that was for purposes of having that readily available so that we can do some of those double checks and making sure that that people are understanding when a report is required and when it is not, unless we can get the statute to do something more simple. It would be easier for us to have this information in the report.
I would vote for more simple.
I would too.
I would,
but
vote
I don't
for
get
that
to change the
because
statute.
it definitely is one of the more complicated calculations, and that's something that we strive to help. And so if I mean, we would love to have examples of these calculations where there is that yo-yo pricing, so that we could use those examples and help explain this to manufacturers, because of course we try our best to put it out there and kind of show these differences and that kind of stuff, because the weighted average can become quite complicated if there's more than one price increase in a year. If you do have this yo-yo pricing, then it really gets complicated. So if there's any way that we could have examples, Sophie, I know that's a lot to put on you, but if there is ways of having
Yeah.
examples, that would be really, really helpful.
I do have a spreadsheet calculator that I use, and so it's possible that we could look into whether we could publish that for the public to use as well.
Yeah,
because
that'd be
you
great.
know, I can just plug numbers into it, and but it's just something I created, so I'd have to
Yeah.
see about having somebody more professional publish something.
Yeah,
So,
that I
we'll see.
understand. That I understand. So thank you so much.
Yeah, thank you, Lynetta. I mean, we do really appreciate hearing kind of like the practicalities of this. Like and we do honestly want it to be as simple as process, and we do have to have it be consistent with statute, just in terms of, what statute says in terms of reporting requirements right now. But I do really like Sophie, your idea of, seeing if we could put in a calculator, or at least put in some examples not into rule, but into a kind of program manual type of thing with different scenarios. Samantha, go ahead.
Hi, thank you. I know earlier we spoke about like the look back period, but I did have a question. Just if a manufacturer acquires a drug and they did not take that price increase the previous manufacturer did, would they still need to report on their price increase? And if so, they might not have all of the factors and those kinds of information to fill out those
Right.
fields.
And I assume you're talking about like a mid-year purchase, so it would still be within that reporting window. This must happen quite a bit. Sophie, is that something that you can speak to? I mean, in terms of a kind of mid-year purchase of a drug and how that reporting.
Yes, a drug might have been increased, and then it might be sold to another manufacturer who would be required to report it because it meets these pricing thresholds. And so they would have to just report what they have access to. If it was from an unrelated manufacturer and they cannot get any information about the reasons for the price increase, then they would report what they can provide and explain that the other company did it.
Okay, thank you.
Hey, this is Mike again. Sorry, but she's absolutely correct. We're looking at product acquisitions right now. We started in January, and we don't know when they're going to take place. And I have no idea if the company that we're looking to purchase them from has done a price increase. And so it would be very difficult for me to go back, unless they freely gave us all that, to go back and find that information. But also, I would hate to be penalized for it if I had nothing to do with it before I bought the product. So there's a couple of things there in play. One, I could never give you the exact date that I'm going to purchase something in advance unless I had all the data already ready to go and it was just a question of everybody signing on the bottom line. But secondly, if they don't tell us their pricing history other than, that calendar year or whatever, I would hate to think that my company just buying the product is liable for any kind of penalties as a result. So I understand the concept of the prior pricing should be in compendia, but let's not penalize me just because I bought the drug during that calendar year. So
Yes. Yeah. Yep. Understood, Mike. Thank you. So opening it up to other kind of overarching thoughts. We've talked about reporting year. We've talked about a lot of things. Sorry, I was thinking back to kind of my list of questions. One specific question I had, if you could scroll down just a little bit, Karen. We're going to go back to that section that we talked about extensively at the beginning. Yeah, just a little bit more. That's great. these factors, one of the differences, Daria, you noted they're pretty much exactly the same as what we had done in the different section in 2004, but using the word changes, and again, that's that can really be an increase or a decrease. And to us, it was kind of akin to putting in the term or loss, like net profit or loss, is just, wanting to capture that kind of full picture and full story, but want to make sure that that's, clear to folks and not just clear in our own heads. Go ahead, Daria. Yeah.
Not on that. I think changes is clear, but while we're on this section, just wanted to raise kind of a general, bigger picture comment, going back to some of our previous conversations, that the data collected by the department based on your database and how it's input is at the NDC 11 level, which is, down to the amount of blister packaging, perhaps, not about differences in drug or, the actual drug itself. And yet these kinds of questions about marketing costs, distribution, the ongoing safety and effectiveness, these are very big picture things that apply to the whole drug, not the packaging differences at the NDC 11 level. So just a general comment, recognizing that there's sort of a disconnect there, that you're going to have the same information for every package size of that drug, and that's a lot of data, repetitive information provided by manufacturers to the board. That's it.
Appreciate that. Yeah, talking about, I get what you're saying. I think kind of alignment on level of information that we're collecting. I said before, we like duplication. We don't like unnecessary administrative burden. We still have a little bit of time. We don't need to take it all. But if folks don't have any specific comments right now, again, we will be accepting written comments based on this conversation. I believe we have it on there until the 12th. And I won't forget to do public comment, Karen. Thank you. But if you go to the next slide. Yeah, so if you could get me any written comments detailing anything you've talked about and anything else that, has kind of come up based on our conversation by the close of business on June 12th, that would be wonderful. And you can send those to me and to Karen. Before we go to public comment, I do want to ask folks, do you think we need another meeting? It's, I don't want to waste anyone's time. We, of course, certainly wouldn't have to take the whole time, but I do know review and preparation can take quite a bit of time. So curious, people's thoughts about having another meeting where we, have a similar conversation based on some changes that I will have made based on your comments and internal discussion. If that would be helpful, or if you would rather just see it as part of the official rulemaking process where there would be a hearing and another opportunity to officially submit comments. Saw you thinking about it. People can also email me if you feel more comfortable talking with teams or thinking on that a little bit more about whether or not another RAC meeting is needed. Okay. Let's go ahead and go to public comment. Karen, do we have anyone signed up?
Let me take a look in the chat. I don't see any.
Okay.
I do not. Nope.
Okay. Well, since we do have a few minutes, I'll just Are there any other thoughts that RAC members want to leave us with at this stage of the process? Yeah, go ahead, Lynetta.
So it's fine to just send you an email with suggestions for other items that we need, maybe a little bit more clarity or definitions on.
Please.
Okay.
Yep.
Yeah, I have a list. I have a list.
Great.
You know
Great.
me. I have a list.
I love it. Yes.
But yeah, I think one of the biggest things for the industry and something that we struggle with is introduced to market, or the date in which something is introduced to market, and working with the pricing compendias, which is also another interesting factor, marketing start date and NDC WAC effective dates. So introduced to market is something that I hear from manufacturers as what is the state actually looking for there? And I think the latter of the two is kind of where Sophia and I have had some conversations. So if there's some definition around that as well, that would be great.
Mm-hmm. Great.
Thank you so much. It's always a
Thank you,
pleasure to
Lynetta.
talk to you.
Yes, I mean, and really all of you. Yeah, I just, don't want to leave too much awkward silence, but want to give people a chance to think and offer any other comments to the group. While you're thinking, just a note for those of you who are newer to this process, and Karen, please correct me if I'm wrong on this, but in terms of the comments that we receive at this stage, during the RAC stage, those written comments do get published to our website. Is that correct?
Yes.
Okay.
It may,
Great.
it's
So if
not going to
folks,
happen.
yes, it won't happen immediately. Of course.
Exactly. Yeah.
But that is something that will be public, so you'll be able
Yes.
to see what your fellow RAC members are commenting on, that perhaps they didn't get a chance to do today. And I will say, as part of the next stage in the process, where there's the more formal hearing and there's an opportunity for everyone to, anybody who attends, to comment and provide written comment. We do, in the final hearing officer report, and that would be a report from me, would comment not necessarily item by item, but on kind of big picture, how we made decisions with the final rules, and comments that we weren't able to adopt and comments that maybe we were. And I will say that, a number of things that we talked about today were a little bit more at the program level. So thinking about, doing examples of, yo-yo pricing or kind of timing of reports. Also, there were a number of questions around, how things are handled when a drug is purchased by a different manufacturer mid-year. And I think a lot of those are really good questions to be asking program staff, and that they will be able to give a more definitive answer. So certainly I can be a conduit for that, but I'm not in the day-to-day of collecting or doing anything with the data itself, and so they're much more hands-on and can be answer that a little bit more accurately and better than I can. And I've gone through a lot of different scenarios too. So really appreciate everyone's time. I'll just open it one last time if there are any kind of other thoughts about the rules or questions about the process. Okay. Thank you all so much for your time, and we look forward to your written comments.
Thank you.
Have a good one. Take
Thank
care.
you. Have a good night.
Bye-bye.
Bye.